Welcome back to Dermcast Studio. It's Rob Casquejo, and I'm here today with the world-famous Dr. Glynis Ablon. Welcome to the Dermcast Studio. How are you doing, Dr. Ablon?
I'm doing great, except I'm still on LA time, but other than that, I'm good.
You know, I feel you because I came from Arizona, so I'm in the same boat. Yeah, I'm still working on my clock adjustment. Well, thank you so much for being here, and this is great because we're going to talk about some topics that there's not necessarily a ton of academic opportunities to learn about them. So you're giving a lecture in the conference, the SDPA conference. So I'm going to hear about all the stuff that you're going to talk about and teach us about. So let's start. Tell us again. Tell us more about yourself, your academic background, and so forth.
So I am a board-certified dermatologist, and I'm an associate clinical professor at UCLA, and I'm the director of the Ablon Skin Institute and Research Center in Manhattan Beach, California.
Okay.
Sunny Manhattan Beach.
I love Manhattan Beach, one of my favorite places in California. So are you a Cali girl? Like, did you grow up in California?
I am born and raised.
Born and raised.
Born and raised.
That's great. That's awesome. So, so you're going to talk about skin tightening. Okay. So let's start by, give me the mile-high view of how you evaluate somebody in terms of deciding a path of treatment for skin tightening.
So I think it's really important when you have an aesthetic patient. It's kind of, you want to talk about the overall look. So the first thing I talk about is looking at the structural situation for the patient, which means on that individual patient, structure, which is skin, fat or fat pads, muscle, and bone. And you're really, again, looking at that overall look. Then I go into the morphology, which again is kind of the way the face looks, the bony structure, but also how they fit and the proportions. And then I go into the symmetry of the patient. It is important to understand, though, that what you see as a physician may not be the same as what the patient is concerned about. So it's really important to evaluate, I think, in that way, but also then hear what the patient is there for. And sometimes people will just say, I just want skin tightening, and you're looking at them thinking, oh boy, they really need to get rid of the sun damage, and all of those things really factor into that structural form that I mentioned with the skin. So I think it's important that you're on the same page and being really realistic and honest what the expectations can be for what kind of procedure you're going to do. Once you decide to go down that route of skin tightening, then you have to decide, okay, what are my options? And same thing, I present an armamentarium of options to my patient and discuss, okay, here's what this does, here's what that does, here are the side effects, here are the complications, and they go home with a ton of paperwork to read and look at and then call back with questions, because we call them the next day to answer any questions they may have of any of the treatments that we talked about.
That's great. So when you're evaluating for skin tightening, let me just a broad question. Is there anyone you would look at and say, I don't think you should do skin tightening? Is there a situation like that?
So again, I'm very honest with my patients. That is not uncommon. I do see patients where, not always, but there are a number of patients where I look at and say, I really think that probably what I do is not going to be enough. But in this day and age, more and more patients are looking for alternatives to surgery. We are seeing less patients getting surgical procedures. And as you notice, a lot of them, when you talk to plastic surgeons, they're doing a lot less of the invasive surgical ones and doing more of the non-invasive. The best information, again, is that it's also not one thing. It really is the combination of things that we can offer to our patients that will give them the best results. So skin tightening, yes, but you may also need some fillers, some neuromodulators, things like that. So again, it's really important to be honest with the patients. And I'll show today in my presentation on that, I have a patient that I did say, I think, as a 73-year-old woman, she had a lot of laxity in the skin, and I said, probably your best bet would be a facelift. And she said, I'm not having surgery. I don't want that. We ended up going with a skin tightening device that I'll talk about, and she looks like she had a facelift.
That's great.
It really is remarkable. So we can get amazing results with newer devices.
Okay, that's great, and it's a good segue to this. So let's talk about some of these devices. This is where the rubber meets the road when you're in the room treating the patient. So let's take that patient as an example. Your evaluation was pretty clear. She was elderly patient, a lot of volume loss.
Not elderly.
Okay.
We're all getting up there, so I say mature.
Mature.
I like mature.
I like it. I use the word wise in my
I use wise as well.
I like wise. So this patient, we probably all have a pretty good picture of what
You'll see the picture today, but yes,
might look like.
Yes.
So talk about the evaluation we sort of have heard here, and so talk through the device you used, how you explained it to her, why you thought it was a good device.
Yeah, so the device that she had was actually SoftWave, which is the synchronized parallel beam ultrasound technology. And it's a device that heats up the skin. It is real-time visualization is not necessary, so you have it automatically shut off. You don't have to worry about it overheating the skin. And patients have pretty much no downtime. I always explain again that there's always that small percentage that can have swelling and things like that. But most patients, about 90% of patients, have no downtime whatsoever, so there's no recovery. And all it does is basically create new collagen and elastin and lift the skin. And that's exactly what it did for this patient. Now, that doesn't mean that she doesn't need anything else, but she is thrilled with her results.
That's great. So ultrasound is one of the technologies we know can help with volume recovery. Talk about another technology, just so maybe we can show some fair balance.
No.
Here.
Another technology that I love now is my new fractionated ablative cold fiber laser. It's an erbium laser, but it's a cold fiber laser. And I'll show a video as well. It works really, really fast, and it allows me to tighten the skin, but it also allows me to get rid of sun damage. So it has different modalities, and I can adjust based on the patient, where I can just improve the skin quality, or I can improve the tightening, or I can do both. And the speed of which I can do this procedure is amazing. I mean, I can do a full face in 15, 20 minutes. And they say that you can do without numbing. I have done patients without numbing. I always numb. I like patients to be as comfortable as possible. But this can be done without numbing. I've done 3 of my staff with no numbing. So you can do it without numbing, and the patients look great. They have minimal downtime, and they really can get, especially on the neck, a really amazing tightening and lifting.
And so the non-numbing folks that you treated, are you using cool air or just straight up? You fire away?
Straight up. It works really, really fast. So it's not without any discomfort. Now, again, that's why I like to numb. My staff is just, we're always in a rush trying to get things done. But, but I like to numb, period. But it can be done without numbing, and because it is so quick.
That's great. And this
that is ultra clear.
Okay, ultra clear. And this is a fractionated?
It's a fractionated
erbium
cold fiber laser.
Okay, got it. That's very interesting technology. Yeah. So you've got the treatment, the evaluation, the treatment options, and there's probably several more devices we could spend.
I'm going to speak about more today.
Yeah,
yes,
that's great. There's 100 we could probably talk about. So overall, talk about the pitfalls. So you've already mentioned evaluation and being realistic with results. So let's talk about more physical consequences, something that might go wrong with skin tightening, and how you can sort of pre-evaluate for that, and then what do you do to deal with them?
Yeah, so I'm, again, very honest with my patients. I have long before and after information sheets that talk about what to expect, talk about what to do to prepare for the procedure you're getting done, what to do afterwards as far as aftercare goes. So I'm very specific. My consents say everything that can go wrong, even though in my hands I may have never seen it. I put down all the risks, even though I'm doing ultrasound and even though it's safe on all skin types. I put down that hyperpigmentation, knock on wood. But the idea is that I explain every possible complication. And I always say that if you do a procedure, whatever that procedure is, you may have 99 cases that go right, but one case goes wrong, and you have to know how to handle it. So that is really important, meaning that if I get a patient, for example, with the soft wave, about 10% of my patients get swelling. Now, I'm very aggressive. I think the reason that my practice has such good results with this device is that I'm very aggressive. But in being very aggressive, that means that I'm putting a lot of heat, which means I can get swelling. And so I warn the patients beforehand, and then I call them the night of their procedure. We talk to them the next day. So there's a lot of hand-holding and follow-up. And for those 10% that get it, I may do some steroids. I'm always saying, after the fact, after that 24 hours, they can use a cold pack if they needed it. But again, I'm very clear on what they need, what the risks are, and what we can do for that. Ablative lasers is very different. Ablative lasers, the ultra clear, even though it's amazing new technology and it works really fast, ablative lasers are ablative lasers, which means that all of the side effects that go along with ablation have to go into your consents, which means pigmentation alteration. It's not common, but it can happen. So I always pre-treat my patients, especially with darker skin types, with a lightening agent, just in case. Anytime you're doing ablation, you do run the risk of igniting the herpes virus. So we pre-treat with antivirals. So again, really going over all of the things that can happen so that patients are prepared, so that if they are in that small percentage of it happening, they're set to go. They're ready to go. They know where. My phone number, my personal cell phone, is on the bottom of every instruction sheet, so they can reach me at any time.
That's great. And these are all, they seem obvious, but they're things that definitely you have to put into action because they can get overlooked.
Correct.
So on the topic of, let's say, darker skin types, in terms of skin tightening, is there something you like to do specifically for darker skin types?
So procedure-wise, yes. So there's another device that I'm going to talk about that is it's basically a tip that is an aluminum alloy. So it's thermomechanical alloy tip, basically. So it's delivering heat into the skin, but it is not a laser. So we're able to tighten the skin. There's very little destruction of that epidermis because it's just delivering that heat below. But we can get really nice tightening on all skin types with that, with very little downtime with that. And it's another thing in my armamentarium of options. I also love radiofrequency with microneedling. I think that's I have the intensive by Endymed, and it works really nicely for darker skin types. But that doesn't mean that I don't still address all of the risks and complications and pre-treat and make sure that they have the lowest risk possible when I do that procedure.
That's great. You know, it's the technologies that are used in these devices to achieve similar ends. It's great that it's become so diversified over time because there was a time not too long ago where there were not a ton of options for skin of color.
I started 27 years ago as a dermatologist, almost 27 years ago as a dermatologist, and we had very few options, and we were doing CO2 lasers on these patients, and the risk of pigmentation was very high.
Right?
It was very high. So it was very different. And even with fractionated, I mean, you still have, you have to just be really honest with the patients. It lowers it, but the technology just continues to improve dramatically so that we can get great results, and these patients do really well.
That's absolutely right. So that's great. The lecture is going to cover a lot of this, so hopefully that's going to end up, I'm sure, on our podcast. So thanks for touching on those subjects. Very cool. You're also going to talk about a subject that's a subject of interest for me, and I don't know much about it, is regenerative medicine in dermatology and maybe even beyond. But I'm going to let you sort of free talk about this because I want to learn from you in this subject. And then there's this terminology that you used, cellular intelligence. So maybe start by explaining that concept.
Okay.
And we'll go from there.
Sure. So the idea is that, years ago, decades ago, centuries ago, we had Eastern medicine. Western medicine comes along, and the idea is that we can control most things. AI, artificial intelligence, has come along, and the thought is that it can pretty much take over anything. But what we know based on algae and amoeba is that our cells are smarter than we think. They have their own cellular intelligence that makes it impossible for AI to take over everything. And it means that our bodies can do things that are miraculous. So when we talk about regenerative medicine, it is, when we're young, our body regenerates itself. Why? Because all the cells in our body are youthful, they have lots of growth factors and cytokines and all the right aspects to work in most situations. Obviously, there are children that are sick and have issues and things like that, but normally our bodies can repair. When I was a kid and I broke a bone, it healed like that, and then you end up in your 60s and 70s and something happens and it doesn't return the way it did when you were younger. So regenerative medicine is a way to address all of these kind of issues, and in, of course, dermatology, rashes and connective tissue diseases and things like that, and make our bodies new again, and help heal our body, and help regenerate our body, and regenerate our skin, and change the things that are happening with time and with senescence. And so I'm going to talk about tomorrow the idea is that we're looking at, kind of where do we get these mesenchymal stem cells? Where can we get them? And then how can we use them in the practice of dermatology? So there are a bunch of different categories, but the main ones I think that people know about and use in dermatology really are things like PRP, where we're taking basically platelet-rich plasma. We're taking our own plasma, we're taking off those platelets and preparing them so that they are ready to go, and putting them back in different areas, whether it's the scalp, whether it's for rejuvenation. And again, you're getting these platelets with the growth factors and cytokines, all these great things that the body, the skin, the hair, the nails need. There's also PRF, which is that fibrin that can be taken off the platelet-rich plasma as well. There's also exosomes, and I think that's kind of the frontier of where we're headed. And these are these extracellular vesicles that basically contain the messenger RNA, contain microRNA and proteins, but do not have DNA present. So they are acellular. And they can be used to regenerate, whether it's hair, skin. And again, I think it's going to go beyond. That's kind of where things are headed. What else can we do besides those things I meant? Pigmentary disorders, connective tissue diseases. There was a great review article that came out by Dr. I think Fabi was one of the article writers, and it was, I believe it was derm surgery, but talking kind of the future of exosomes. And I think that the biggest hurdle we have right now is with the FDA and approval of what we can and can't use because of blood and blood products. Mm-hmm. So PRF, PRP, no problem. But when you get into the exosome realm, there are a lot of restrictions on that. And that's where there's a lot of restrictions on different kinds of the mesenchymal stem cells and where you can get them from and what you can do. With your own body, there's a lot you can do, meaning your own products, but using external sources, which are typically from bone marrow donors and from placental tissue, which is where we get those two sources for the exosomes, that's where the controversy arises. And I think we need a lot more data, a lot more research, so that we can feel comfortable using them for pretty much anything. I mean, we can regenerate liver and different kinds of organs. It's pretty amazing.
And you see these things in the medical literature. So is it the case that stem cells, exosomes, there's not a ton of commercial product right now, or is there?
There is some. The issue becomes what is approved and what is not, and what do you feel comfortable using it for. So there are some great companies out there that have some great product, and it really does work. My favorite thing with the exosomes right now is for wound healing. So I have patients that have large cancers that in a normal situation, in order to close it, I would have to do a flap or a graft. And we know that when we take tissue from somewhere else or even flap the tissue, it doesn't look great. There's a lot of healing that goes on, a lot of lasers that we have to add in to make it look better. And I can use exosomes in the field in an open wound, and then in subsequent follow-up visits, and you'll see in my talk where you can't even see where the scar was. So it's pretty amazing.
That's great. So the exosome you're talking about is a commercially available product.
Correct.
Okay.
Yeah, the one that I'm referring to right now, and that one was Exocell Bio is the company that I got that product from.
So I know, I've heard of this company. So do you know, can you talk about the engineering of that project?
So again, there's this placental-based tissue, and they use that to create the exosomes. It is a long and arduous process, and I'm going to go over a lot of that tomorrow, but a long and arduous process of getting the ingredient that you need and making sure that it is stable, because again, this stuff has a very short curve, and it is frozen, and once you defrost it, that's it. You've got about that 1 hour time to use it or lose it. And it's not cheap. That's the other thing. The cost on this right now is very expensive.
Okay, and is it one of those things where does it count as an allograft if you bill it, or is it billable at all?
Oh, you're talking about billable. So that's a whole nother story. I don't take insurance in my practice. Okay. So I do put things on super bills when I can. I could not answer to that. I think you have to talk to someone who's better at at billing with that.
Okay. So let's flip the conversation back to stem cell, because this is something probably people are a little more familiar with. So maybe talk about some commercial product, stem cell, and where you're using it, or what you like to do with it. So I
use, and I will mention again, the Anti-Age has a great line of products that are ready to go off the shelf that are stem cells, but once they get to that level where they're commercially available, conditioned in a media, there's no DNA in that final product either. But they are not exosomes. They're a little bit, there's a difference between stem cells and exosomes. And so when you're using a stem cell, it is basically kind of telling you kind of transporting the information, versus exosomes really are the carrier of the information. So I think they are different, and I'll go over that as well. So there are products that work really well. They're nice. They can be used topically, typically is how we use them. And they can be microneedled into the skin. They can be used with what's called a transdermal infusion device that I have that I love. That's no needles. It's a microcurrent that can, again, allow that product to get into the skin into the scalp, into different areas that we need, whether it's skin conditions or hair loss or just rejuvenation in general, to improve the look of the skin and hair.
That's amazing. So commercially available products with stem cell in it that sort of, they take the DNA component out to make it, okay.
Right.
With
Otherwise, you're
everybody.
looking at like adipose-derived stem cells, and then that's where the FDA comes in, and it becomes much more difficult.
Right. Okay. And that's what they're using in research for limb regeneration and organ
Right.
regeneration.
Right.
And so
Stromal
forth.
vascular fraction, things like that. Yes.
Right. That's amazing. Wow. So there's a lot going on in this field and range of
moving
medicine.
very rapidly.
That's great. So your lecture, I'm sure, is going to be amazing. I'm going to make sure to catch it, and I'm pretty sure it's going to make it onto the podcast, so the viewers can hear them. You have 2 lectures, one skin tightening, one regenerative medicine, and they'll make it to the podcast at some point, and so that we can hear all of that in all its wonderful detail. So, well, this is really cool for me. I'm so glad I got a chance to meet you and sit and talk with you. This is all amazing stuff.
Not just the elevator.
I'd love to come. Yeah, that's right. I'd love to come and visit the Ablon Institute.
Absolutely.
I'd love to see it. You're in LA?
I'm actually on a movie studio lot.
Oh, okay.
Yes, in Manhattan Beach.
In Manhattan Beach. You mentioned Manhattan. Love Manhattan Beach. Any excuse to go out there. So I'm going to look you up if I go in LA.
Sounds good.
Okay, sounds good. Well, thanks for watching Dermcast TV. You heard it from Dr. Ablon. There's a lot going on in cosmetic procedures, both in skin tightening and in regenerative medicine. So look out for her lectures on the podcast. And thanks for coming to Dermcast TV, Rob Casquejo, Physician Associate.